And as Doug said before we went to break, we are going to be talking with Dr. Andrew Ford. He is, of course, our dermatologist, and we talk about some interesting subject matter. And today is no exception. We are going to be focusing on something called Keratosis Pilaris. Good morning, Dr. Ford.
Morning, guys.
Did we hit
morning,
the nail
viewers.
on the head with the
Yes.
pronunciation?
You get better and better every
Yeah,
week.
Yeah.
They're getting easier and
Because
easier every week.
we
too.
Having the
brace
champions
ourselves.
help, doesn't it?
Yeah,
Yeah.
maybe that's what it is. We are champions. too.
Surrounded by champions.
Champions of the words.
Yeah.
Yeah. So what is this, Dr. Ford?
Well, essentially, it's a type of dryness that's focused and localized with the hair follicles, because there are types of dryness that can be generalized, but this one is kind of specific and just affecting the hair. So the presentation is what people might call goose skin or pimply skin, very hard bumps that you see on the skin. This first one is a close-up to show you the hair follicles and those raised black papules that are about 1 to 2 millimeters, and that represents the increase in keratin around the hair follicles, but you notice that the rest of the skin looks quite normal.
Is this what
part of
body
the skin
part
is
is this?
that?
Is this?
That's a good question. That picture was taken years ago, but it would be the most common places that you get it. You'll see later.
Does it happen in women more so?
It does happen in
That looked
both
like it
sexes.
was a breast tissue
No,
area.
it wasn't a breast,
Okay.
unfortunately. I know I did show you a breast last year, but in actual fact, most of the time, the areas that are affected can be the face, the outer part of the arms, the tricep area, the thighs, and also the buttocks is a very common area that you
So
get
where
it.
you get pressure, in a sense.
In some cases. This is a close-up of the nose there, because that's one of the places on the face you get it. There are lots of people, if you start looking at everyone, you notice these equally spaced little bumps on the nose, and when you squeeze them, little bits of white stuff come out.
Yes.
And people call it worms, but it's not worms. It's
not
the
worms.
it's the
Skin?
keratin
Oh.
coming out from the skin.
And it's
so
it's greasy, oily.
yes, it's greasy and oily. So when you squeeze your nose and deform it, you keep seeing it, and people do that almost every day, trying to get rid of it.
Should we
This is another.
stop?
Well, definitely you should stop, because there are other ways of trying to take
extracting
care
it.
of it. But that shows you how common it is, and that's why one of the reasons I chose it this morning, because it's something that isn't dangerous. It's not really a big disease, but it's very common.
I didn't know there was a name for it. Like,
Yeah,
I didn't know it
there's
was
a
a
name.
thing.
I thought
It's just
worms.
what it is. Time to exfoliate, and that's that.
There's
That's
a name
not
for
it.
everything.
Oh my word. Okay, so what does this have any underlying problem?
Well, sometimes you can have some underlying problems, usually atopy or people who have eczema. And here you see another instance of it kind of localized on the arm on the right side. It looks very, very dry and very dark. It's a localized form, which has another fancy name called lichen spinulosa. But it's the same condition, just that instead of it being symmetrically on the arms or on the thighs or on the buttocks or on the face, as I mentioned before, you can just have little circles of it that they're basically asymptomatic. You don't feel itchy. You just notice that the skin is rough. So because it's rough, it does cause people some discomfort. And you can see here all the hair follicles are highlighted with that dry, scaly keratin on it.
But can you squeeze all those parts of the body too? I mean, I know everybody just presses their nose, but would you want
Theoretically, but I mean, it's not practical, because it's a chronic thing. It starts in childhood, and it tends to go on and usually resolves in around 30 or so for some people, but there are others who can have it more often. Sometimes it can be associated with some types of food allergy as well. Some people that have casein intolerance or need more fish oils and that sort of thing can manifest it as well.
Well, speaking of that, is that what you do? Do supplements help take care of this?
Well, it can theoretically, but usually not practically. The elbows is another very common area that people can identify with. Little bumps on the elbows that are very thick, and you rub them and you feel them all the time, and that's a very common manifestation of keratosis pilaris.
How do you get rid of it?
Well, it does take some work. The important thing is to moisturize the skin a lot, use cleansers that are not irritating, but then you can use physical things like exfoliators, things that can peel the skin, like the alpha hydroxy acids, glycolic acid, things that have in salicylic acid, urea, lactic acid, all those things work. In addition to that, you can use that in combination with a very, very weak steroid, or there are other peeling agents that are called retinoids that are also used for acne. Physical things can be used, dermabrasion, chemical peels, again with glycolic acid, but they're also starting to use lasers mostly to try to get rid of it, impulse light lasers and other lasers. And this shows you the back of the thigh, another very common place to have it. Lots of people feel the back of their thighs in their hamstring area and notice this rough bumpiness there that they may think, you know, that it feels like pimples. Most people would say it feels like pimples. So that's another common manifestation of the condition.
All right, we have a photo that may be a little sensitive, hard to look at. So if you are sensitive, you might want to just listen to the doctor talk about the next slide. Okay.
Yes, there are some sequelae of keratosis pilaris where you can get pitted scarring. So this can happen on the cheeks a lot, and it can happen along the eyebrows and other areas where you get keratosis pilaris. So that's one of the complications and one of the reasons why if you have it and it's severe, you should seek some attention. But there are things that can be done for that. Well, that's a very severe case, but usually you see people with little ice pick scars on the cheeks, and that's one of the other minor manifestation, and you can use microneedling techniques to get rid of them and to get some resolution.
Can that cratering happen if you squeeze?
Well, certainly it's possible, but most, you know, the average person won't end up with this severe version of the problem.
Why does it get so bad in some people?
Well, we just don't know. Just some people tend to get the more inflamed type. So if you get it really inflamed, because sometimes the bumps can be skin colored, sometimes it can be red, and the inflamed types where people are prone to scarring, you get that happening, and the hair is lost in those areas too.
That has to be tough for someone to deal with aesthetically as well.
Yes, definitely. That's one of the main things about the condition, the aesthetics, especially if it's on the elbows and you're like wearing lots of short sleeves or some other place that people can see. So that's why it has to be worked on. But it's more about controlling it and working with it, like you maintain a car. If you can exfoliate and keep the bumps flat, then they will feel a lot better, and also you won't see the discoloration.
And you mentioned moisturizing.
Moisturizing, and I wanted to raise that specifically because a lot of the moisturizers which have oil, could that exacerbate the problem because it is kind of oily?
Well, usually not, but only in some unusual cases you can get some secondary infection and that sort of thing. But usually, fortunately, in our weather, we always get warm weather here, but in countries where you have climatic change, in the winter it can be very troublesome and can wax and wane during winter versus summer. But luckily, we're warm all year round here.
So for someone with this condition, and say it's severe, well, from the mild to the severe situations, for them to moisturize, what is the best type of cream to do it with?
Well,
not a brand, but the best type. What should it contain?
Well, when you moisturize, it depends on the degree of dryness, and basically the drier you are, the greasier your moisturizer should be. So it has to do with the base and the consistency. You want to have something that's kind of ointment based if you're very dry. So that's important. Also the frequency. Anytime you have a dry skin condition, you have to feed the skin when it needs it. So when it's dry, you have to reapply. But of course, if you're doing well during the day, then that's fine. But another consideration is the clothing you're wearing, the job you're doing. You know, if you handle paper, you might not want to use things that are too greasy. You might have to work a bit harder at maintenance.
But the moisturizing, back to that, I mean, does not also clog pores, so couldn't it create another problem?
Well, certainly extra moisture can, especially on the face, cause acne. And this is one of the considerations with the keratosis pilaris. There are lots of patients who are being treated for acne or as having acne by doctors, and they don't seem to get better, but they have this fine bumpiness. And in actual fact, it's sometimes a case of the doctor or the person not realizing that it's keratosis pilaris and acne, and not just acne. So you find that they will get better to some degree, but these fine bumps that you have on the cheeks and also on the forehead, which is a keratosis pilaris, isn't being addressed by the therapy. And in that case, the glycolic acids tend to work better.
Is this also where you would maybe advise a patient to look for a product that's, say, non-comedogenic, that won't clog the pores?
Yeah, definitely non-comedogenic is always on when you're doing something with the face, especially in our hot, humid climate. You know, you can get tropical forms of acne that involve our climate and the humidity. So generally on the face, you should always use oil-free or non-comedogenic. Only people with very severe eczema on the face may have to use things that are greasier.
Okay.
So all of those young people who think they have pimples, You have keratosis pilaris.
Some of them.
He said me. Just check it out. Now you have something else to ask a question about.
Yeah.
But thank you very much, Dr. Ford, for sharing with us this Tuesday, and I hope you've learned something, keratosis pilaris. So if you were thinking, well, I see these things and I didn't know, now you know, so now you know you need to have a chat with your dermatologist. We'll take a quick